And so I welcome all of you, and we're going to get started in the real way of ADN, which is invoking music, which is a universal language. And today we are highly honored to have a multi-talented singer and recording artist. She's Zimbabwean-born multi-talented artist. She's been wowing audiences from the African continent and different parts of the world with her amazing songs and catchy rhythms and all of that. But she's here, so I don't need to introduce much. Her name is P-Way. Follow her on social media and download her music. She's won so many awards. So she's going to take us all the way to the motherland and with the incredible instrument called mbira, which is a native Zimbabwean instrument, but you can also see expressions of the mbira in other parts of the African continent. In Ghana, it's called the kalimba, and in so many other places. So anyway, I introduce and I give you the magical, phenomenal P-Way. Take it. And in the meantime, please mute yourselves, everybody else. Just click mute button and mute your microphone so we can enjoy this lovely performance. Thank you.
Wonderful. Thank you, Chike. My name is P-Way, and the song is called Nemam Sasa, which means one who goes for the future, like you all are doing. And thank you for having me. Nemam sasa karinge sula na mwecha uyaimbo. Nemam sasa karinge sula na mwecha uyaimbo. Amwe bana menyu bana mbutera tanga pira kare nechino kaji no dalamwe bari kuramba. Amwe bana menyu bana mbutera tanga pira kare nechino kaji no dalamwe bari kuramba. Janya nya Diani wadaita no Diani wadaita Diani wadaita Diani wadaita baba Diani wadaita no Diani wadaita Diani wadaita Diani wadaita baba. Nemam sasa karinge sula na mwecha uyaimbo. Nemam sasa karinge sula na mwecha uyaimbo. Onaka nemam sasa karinge sula na mwecha uyaimbo. Nemam sasa karinge sula na mwecha uyaimbo. Polio. Thank you. With a few minutes, I'm just gonna quickly do, I call it the national song, and then I'll close out with a song that I would like for everybody, just get up on your chair to dance. This is in honor of our speakers, so would love for you to join me. But for now, I'm going to honor the continent of Africa through Swahili, Xhosa, Zulu, Shona, and yeah, that's pretty much it. And so join me if you know the song. Mungu ibariki Afrika, wabariki viongozi wake, hekima, umoja na amani. Hizi ni ngao zetu Afrika na watu wake. Ibariki Afrika, ibariki Afrika, tubariki watoto wa Afrika, Nkosisi keleli Afrika, malupakanisu mpondolwayo, izwa imetandazo yetu, Nkosi sikelela tina, lusapolwayo, morena boloka si chabasayeso, Ofides editwele matwenye ho, Oseboloka, 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 Sechabasa, Jesus Sechabasa, Africa, Ishekomborera Africa, Gaisimudzirwe zitarayo, Inzwa imiteuro yedu, Ishu muriayo, Uyamweya, 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 Komborera, Uyamweya, Uyamweya, Muchene uti, Komborere. So to close out, we're just gonna do a song from Senegal. It's called Koumanehu, and feel free to join. I don't know if you guys can hear it. All right. Yola, Yola, so everybody get up from wherever you are. Come on. Jolly, jolly, nehumane huma yasamara. I know there's some Senegalese people in the video, so do your thing. Nehu jampole, kumanehu yaya jene, sumamai yaya jene, sumamai yatafede, sumamai yatafede, sumamai yatafede. Only then come on you, yare tumta juranya. Senegal wanda mana genang All right, that's it from me.
Fantastic, fantastic. Thank you, Piwe. Thank you so much. And
thank you, Chike. Thank you.
What a
Piwe.
way to get us started. And before I hand over to Almaz, just to say, you know, yeah, Piwe, feel free in the few minutes you can log off and all of that. But for those of you that are not aware, the song that she sang for us, you know, is Lord bless Africa, may her spirit rise. Hear thou our prayers. Lord bless us, Lord bless us. May her spirit rise. Descend, O Spirit, descend, O Holy Spirit. Lord bless us, your family. It's really become the African song itself. So thank you for blessing us with that. And, you know, and also close it out with a tribute and honoring our special guest. And I will say to our special speaker, Nagadef, Mango Feet. Okay, all right.
Thank you.
Chike, thank you, Piwe. Thank you so much for honoring us. My goodness, Chike is my wonderful friend. Chike and I, we've been trying to really figure out how to support the arts community during COVID, and we have a plan for the next 7 months. We will have every month one African singer or performer to come and show, and then Chike is also running another parallel event every month showing Africa pictures. We will continue to share, and I do hope you participate. Good morning, my name is Almaz Negash. Welcome. I am the founder and executive director of the African Diaspora Network. I am privileged to do what I do because very few people are able to do what I do, which is to be with you on a Wednesday morning. We have people from Kenya to Senegal to Ethiopia. I just saw one from Ethiopia, all over the United States and Europe. So thank you, welcome. We are who we are because of you, and we get better every single day. We learn from our mistakes and we move forward. But this has been a fantastic opportunity for us to pivot from in-person meeting. The African Diaspora Investment Symposium is a flagship event where we bring about 300 to 350 people from around the world to Silicon Valley. Since we're not going to be able to do that, this is the best way to connect, to learn from each other, to share resources, and to grow together, to do better in the community where we live and the continent where we come from. Some of us are from Africa, some of us are friends of Africa, some of us are trying to learn about Africa. So welcome everyone. I'm very privileged to be with you today, but especially privileged to have a special guest today with us, Dr. Sal. Sometimes it's we take it so for granted that we do actually have innovators and brilliant individuals in the continent trying to make a difference in the community. And I am personally humbled this time because it is actually so telling that we have Dr. Sal with us today because of the challenge of COVID. But I also don't want it to be just only a one-time thing. It's actually a good opportunity for us to continue to remember there are people suffering, and how do we really actually support programs, opportunities that are happening within the continent and outside of the continent to make people make people suffering a bit less. Personally, this morning I'm not going to say much. I have people who are going to say a lot more about what we're trying to do, but I wanted to make sure that I start by thanking our funders. We are able to do what we do because we have funding from very generous foundations and individuals, which you can find all of their names on our website. The African Diaspora Investment Symposium website actually is now only not just a place for speakers and to show our funders, but also we made it a go-to place for resources, any resources that you're looking for, and also to really register for the upcoming events, including our September event, which will be moderated, and it's a partnership with the State Department. My favorite people from the State Department, and at least my compatriot Thomas Debas will be moderating, and so that is on September 23. Please register for that. We have the registration open. I want to especially thank our board, our Executive Leadership Council, my team. I mean, they work so hard. I make them work hard, and I work hard. We work hard because we're very small, but we do the best we can to make sure that what we said is what we do. And our partners, we can't do this without our partners and our champions. Each one of you are here today, and thank you. And special thanks to Dr. Amadou Sall. As I said earlier, I'm very proud and honored to have you with us today. My wonderful board member, Andy, thank you. Josh, both of them are on the board, and Josephine is on our Executive Leadership Council. Thank you. Elian, a wonderful friend of mine, thank you very much for being with us. Alan, and I know each of you will be represented or introduced by your moderator. For right now, I just want to make sure that we have some logistical things I want to share. Please mute your audio throughout the event so we can have a good recording. Use chat for questions. Polls, we have 2 polls. One is just a regular poll about the subject that we're talking. And then at the end of this time, we really want you to poll on the event itself so we can do better as we move forward. Anything that has to do with media, I would encourage you to contact Liz Grossman. She is our PR person. She is right now in with you. If you happen to be from media, please contact her. You can keep in touch with what we do by joining the African Diaspora Network online platform. That's a wonderful place where you can continue the conversation. And I think this is all I want to say. And then I'll give the stage to Josh, who's going to say a little bit about ADN. Josh, where are you?
Yeah, can you hear me?
Yes.
Excellent. Thank you, Almaz. It's a pleasure to be here today with this whole group to talk about healthcare. But I just want to do a couple of just quick introduction. One, ADN itself. I think as Almaz talked about that, this is 10-year anniversary almost soon, I think. Yeah, so this is, I think, a network of people that are or diasporans from Africa, but also friends of Africa that do care about the continent. And how do we actually use this human capital to actually advance different topics? And that's the role of ADN. In ADN, there's a couple of areas that we're focused on. One is healthcare, which we're going to talk about today. We're going to continue to talk about financing, investments. And by the way, whether we talk about education, healthcare, everything, all of it requires investment in Africa. And what do we need to do collectively? Because if you look at models and successes that we've seen around the world, it's because of diasporans, because of people engaging in what's happening in different continents and different countries. So for us, I think our focus has been healthcare, financing, education, but more importantly, connecting people. I think this is going to continue to be important because you can have all the money that you want, you can have all the ideas. If you don't have the people, the capability, and the human capital, it doesn't work. So I think what you're going to hear today is we're going to talk a lot about healthcare, knowing we're in a COVID situation. I think with Dr. Sall, we're going to hear about what's happening directly in the continent at the beginning, and then we're going to move on to talk broad areas, not just about COVID, but the state of healthcare in Africa. We're going to talk about the role of innovation and technology in Africa to be able to advance some of the things that you're going to hear today. We're going to talk about what's the role of diasporans and friends of Africa, because this is, as ADN is focused in 2 areas. One is, how do you create that connectivity with the continent? But it's also very important that we do the things that need to be done in our communities, regardless of where you live in the world. So this connectivity that's actually needed, whether in some cases it's through investments, some cases it's the capabilities that are available around the world. All of that is going to be key, so we're going to touch base on that. But my recommendation to all of you today is, I believe we had over 300 people registered. I think we're going to see more people continue to join and drop out depending on their schedule. If nothing else, I would highly recommend all of you to go to the ADN website and sign up and become a member. I think this is very important because we're going to continue to have this discussion. We're going to continue to create opportunities, whether it's in terms of opportunities from jobs, in some cases, whatever community you live in, but also the connectivity with the continent to be able to mentor, invest, and be able to take real activities through ADN. And I think I would highly recommend, if you're not part of ADN, which from what I've been told, about half of the people that actually come to the sessions are first time ADN, joining ADN for the first time, ADN or at these sessions. So highly recommend that you join us and become a member so that you can stay in the loop. And it's up to you then to decide how much you want to participate on an ongoing basis with activities that are happening in the continent, but also in your communities, regardless of where you live around the world. With that, I think what we're going to do is we're going to kick off the session. Let me invite India and Dr. Sal to talk about what's happening in Africa and the innovations related to COVID. And then we'll come back and do a panel session, just a broad space in terms of healthcare investment in the continent. With that, let me turn it over to India. You're on mute. Sorry.
Good morning, everyone. Can you hear me?
Yes.
Yes.
Hi, my name is Ndei Makalu, and it's so exciting to be here. And first of all, thank you so much for this wonderful performance, and wonderful, and so beautiful. Again, good morning to everyone that has joined us today all over the world. Good morning, good afternoon. It is really a great privilege and honor on this very important day to actually host Dr. Sal. As you have seen in his bio already, Dr. Sal is the CEO of the Institut Pasteur of Senegal, and he's a world-renowned scientist, sought after his expertise in public health and also in pandemic situation. He has been at the forefront of the COVID-19 fight since the beginning, and it is really with absolute pride that I welcome him, my fellow Senegalese, to this forum. I'm really super excited and very proud to do so. So welcome, Dr. Sal. But before we get started, I would like to leave you the forum a little bit to tell a little bit about yourself. Is there anything that you would like to say before we get into the questions?
Yes, thank you. First of all, I really want to thank the organizer for giving me this opportunity to address such a large and knowledgeable audience. And it's a great honor and privilege for me to join you this morning. I feel like in Africa, diaspora is probably one of the major wealths that we have. And when you actually give attention, this can change a lot in this continent. I want to thank especially Almaz and Ndei for taking time to discuss and inviting me to this. And really want to congratulate the previous performers for singing in Senegalese and wow. We really appreciate that. So I couldn't dance, but I really appreciate it. Yes, one thing I just wanted to give two quick introductory remarks concerning COVID and what we do. First, I just want to talk about what we do as Institut Pasteur. As Ndei was mentioning, I'm the CEO of Institut Pasteur in Dakar, which is a biomedical research center where we are combining like all the Institut Pasteur in the 5 continents and 33 countries. Public health, which is very important, and we combine that with research, training, and in some area we are doing some specific activities. In Senegal, not only we are doing services like vaccination, blood testing, and trying to help food safety, but we're also manufacturing vaccines, which is yellow fever. We are one of the WHO pre-qualified vaccine manufacturer, the only one in the continent. And at the same time, we're doing a lot of research, mostly focused on epidemic disease and endemic disease like malaria. At the same time, we are a center where people can get training and education, because every year we train around 100 people, from PhD to technicians. What I want to say about COVID is that when I think about it, I have in mind one quote from Winston Churchill. Winston Churchill used to say that a difference between an optimist and a pessimist is that an optimist sees opportunities in any difficulties, while a pessimist would see difficulties in any opportunities. And when I think about COVID, it's just like it's a real difficulties. But at the same time, I see this as an optimist where we have a lot of opportunities to show what Africa can do and how Africa can take advantage of this situation, even though it's very harmful and very difficult. We're talking today about more than 1.2 million people being infected, almost 30,000 deaths in Africa. And in many countries, when we talk about Africa, even though you have a diversity, COVID is extremely disruptive, but at the same time, I've seen during this period a lot of creativity coming out to face the challenge that we're having. A couple of challenges important, like supply chains. And just one example, now you can see in Senegal, in many African, that the local industry, the local people can actually work out and make some, manufacture some masks. Some can be very innovative, but very interesting. You can also see, to face some difficulties, people are actually being extremely having a lot of solidarity, and you could see also some leadership happening. And all this, when I see that, make me very optimistic, even though it's a very difficult time, that we can take this opportunity to build what Africa needs when it comes to epidemic. Every year, WHO spends 80% of its resource to focus in 2 areas in the world when it comes to epidemic, in Africa and Middle East, 80%. And out of that, Africa is really the majority of it. And because of that reason, Africa is not only facing it, but is also has built over time since 2005, some sort of capacities in order to be able actually to face epidemics. And one surprise that people have, that people were expecting Africa to be very much with a lot of death, and prediction was very, very bad. And still, even though we cannot know what may happen, we see this not happening the way people were predicting it. And this is probably something that people have learned over this time through this different period, where actually Africa has faced different epidemic, and that has been also some opportunity to learn and do things. And the other thing I wanted to mention in this regard is when we talk about innovation, we also realize that Africa is lacking a strong industry in the field of medical countermeasure, like vaccine, diagnostic, at the same time, therapies. And I think one major lesson we need to learn from this is really that this needs to be built up now and be very strong, because as we can see, everybody is competing for those medical countermeasure. And this may be also an opportunity that needs to be seized and done by Africa. And the last thing I wanted to say is that people are talking about post-COVID, and I think for Africa, there should be also an opportunity to build a new public health order in terms of reinforcing the public health system, reinforcing the workforce, and be able actually to set up what needs to be protecting people. I'm gonna just stop here today and for these introductory words and take any questions or discussion you wanna have. Over to you.
Thank you so much, Dr. Sal. And indeed, it's absolutely important. You know, you mentioned the creativity, the innovation that is happening in Africa, and it's absolutely wonderful to hear that. But also, I think this is also the opportunity for the continent to actually lead the world in the fight against this pandemic, because we have what it takes. Let me get to the question. You know, as I mentioned earlier, you have been at the forefront of the fight against COVID-19. And something that really got me excited in the beginning was that the rapid test that you have been working on with your team at the Institut Pasteur in Senegal. And I also understand that test was meant to be also shared across all Africa, which is wonderful. And having that test really manufactured in Africa will actually solve a big problem of market access. So the question for you is, like, where are we right now in terms of that test that you had mentioned back in March?
Yes, thank you very much. This is a very exciting and good question to give me an opportunity just to tell you about what we're doing here. One of the main problems we have in Africa is access. And when we talk about access, we're talking about medical countermeasure. The health system in Africa is weak, but when you take the whole health system, laboratory is something that is probably the weakest. And for that reason, surveillance is not doing well, detection is not doing well, and diagnostic, which is usually a point of entry, is actually impaired by that. So that's why we wanted to have the test that is available, a test that can reach different population, and a test that is affordable in terms of financial access. And that's why we came with this project called Diatropics that we built with 4 different partners that I want to quote quickly: FIND, Fondation Mérieux, IRD, and us. And at the same time, we have industrial partners like Mologic and BioMérieux. With these different people, we came up with a simple technology, which is lateral flow. And with lateral flow, we have the target to do one test for $1. And the whole idea is to build a platform where people are mutualizing their funds to build a platform, and at the same time, the country can get it at the cost of good. And that model, which is a bit innovative, help us actually to be able to provide the test at the cost of $1. Now, when COVID started, we started to build this COVID, and we're working with two major tests, one for antibody, another one for antigen. And right now, in June, we finalized the antibody one that is available actually in terms of performance, and that we start manufacturing here. And after we manufactured the first batches, we are actually starting to deploy it in Senegal in different sites as a pilot studies, because what we want to make sure is based on the performance we have in the lab, which is very good, and the way it is operating and having good operational characteristics, we can expand and scale up. Now the manufacturing also started, and we have discussed with WAHO, West African Health Organization, and Africa CDC to deploy that in other countries. We will have this deployment in the other countries starting next month, because we are manufacturing currently different batches to be able to spread it, and by December to be able to distribute more than 8 million tests at $1 into different countries. Over to you.
Wow, that's amazing. Thank you. It's so exciting to hear that. You know, it's going to be deployed next month to all the African countries. Testing is such an important thing. And right now, I think that's what we are missing. And so it's just wonderful to hear that. So thank you for that. I'm going to move on to my next question. You know, because of your expertise in pandemics such as Ebola, the HIV, and even Zika, the WHO and also the West African Health Organization have trusted you to actually help with the other African countries during this crisis. Could you tell us a little bit more about how you are engaging? I just heard you about talking about the test, which is amazing, but also how are you supporting those countries? What challenges do they face? And also what are the opportunities that you also see?
Yes, thank you for that question. One of the, as you said, I've been asked by Africa CDC actually to chair the lab and for the testing. So this is one of the greatest challenges that many countries are having. And when we come to challenges and testing specifically, there are three main challenges. Number one is the supplies. Getting access actually to test is very difficult for many countries. I mean, the kits, the reagent is something extremely difficult to get access and get it actually come to Africa, particularly in a context where borders are closed and we have lockdown in many other countries and competition for the same test. The second major challenge is to have workforce. I mean, in different parts of Africa and different countries, you may have a good central labs where you have competent and skilled people. But when you try to actually decentralize those testing to get early detection, this is something extremely difficult to have because you don't have enough people and you don't have enough skilled people. The third main challenge that people are having is really what we call community engagement, meaning that reaching people, because in terms of COVID, people are at high risk are elderly people, people with comorbidity like diabetes, respiratory problems, or hypertension, high blood pressure. These are the key things where you need actually to identify people early and you reach them where they are. And we know that in rural area and different countries, they are difficult to reach. So you need to have some sort of community engagement where all these people can be identified very quickly and put into the level of care where they can be saved and limit actually the damage. And the last main challenge I wanted to mention when it comes to testing or even providing care is usually what you can have in terms of geographic access, because in many countries you have very large area where the health system cannot reach everybody. And in this regard, I think this is a main challenge that people are working out through different methods, including digitalizations. Now, in terms of opportunity based on those different problems, there is a few things where I think there is some good opportunities. Number one is there is a good opportunity in terms of training people. And when I say training, there is a huge need into providing skills to people, mostly online, and show them how to test, how to take care of patients, how to design as treatment centers. There is a huge need for this capacity building. The second main opportunity is manufacturing. Manufacturing goods for what we call non-medical countermeasure, like what we say mask or hydroalcoholic actually solution to try to disinfect. At the same time, we need things like diagnostics, vaccines, and therapeutics. Vaccine is not available, therapeutics is limited, but for diagnostic, these are a lot of opportunity, whether it's point of care testing or diagnostic at the central level. There are few countries that start doing this manufacturing. And this is also an opportunity. And the third opportunity I see is really digitalization. Because one of the main things today is, for instance, taking care of patients. If you see that patients are usually taken care at home now because capacity in the hospital are limited. Those are digitalization. Now there is a process where people can do like telemedicine, can follow patients using online approach. This is a good opportunity. So when we come to contact tracing, following people actually and doing the contact tracing using apps is something extremely popular. And so that's why I think manufacturing, digitalization at the same time are very good opportunity and training and capacity building.
Wonderful. Thank you. It's great to hear those opportunities and also the challenges that are facing them. But those, knowing that those challenges create opportunity. Now, how would you see the diaspora engaging in the health sector, especially in this fight? You know, beside the capacity, are there any other program to attract like some innovative health technology to support the diaspora direct investment to increase the surveillance and also the response to these capabilities in diagnostic or therapeutics in that matter?
Yes, when talking about the diaspora, I see really immediate action they can do is really workforce. When I say workforce is either they can be involved themselves or they can help people and train them. This is a real immediate need. I mean, a few days ago I was in Gambia and I was very happy to see that one physician come from the US because they want to support intensive care. When you see in Gambia, there is like no intensive care specialists. This was a huge actually benefit for the country. So any people on the diaspora that have capacity in the pillars of epidemic, like technical skills for treating patients, doing diagnostics, or helping people to design treatment centers, or being able actually to support any part, whether it's logistics or informing people about doing like some community engagement. This is number one thing where the diaspora can help. Number two, I think the diaspora should help building more like long-term activities like vaccine manufacturing, diagnostic manufacturing, therapeutic manufacturing. The reason why I'm saying that is I think one of the weakest points we have right now in Africa when it comes to health is to manufacture those products. And in Senegal, as I was mentioning, we have built and we are currently building these new facilities to do much more vaccine that we do now. And the fact that we could hire some people coming from the diaspora is bringing the whole project to another level, because these people have been exposed, they have a lot of experience, and they can help really speed up the whole process. So in those long-term activities, I think diaspora can help in investing or bringing their knowledge actually to build those projects, because these are projects that are industrial, that need capitals, that need also expertise, and that need long-term vision. And right now, there are a lot of discussion, but my number one point is really to bring the diaspora in that. And the last thing is when it comes to innovation. Innovation is absolutely critical in what we do, because when we look at our health system, if you think that the future is going to look like an extension of what's happening, it would be a huge mistake. And in this regard, any innovators that can shift the way we see things in the future can be extremely important for our health system. People now is time to rebuild the health system. And any shortcuts we can take in terms of imagery or building new hospitals or designing new labs or health system is where we need the diaspora to bring expertise and to bring experience. These are the three things I can see for the diaspora.
That's wonderful to hear. That's really actually a great point. And you know, when you look at this forum, the people present here, you have all sort of expertise and experience. So we have heard it all. I like the short term and the long term, what can be done. If I were to ask you right now, it's wonderful to hear the long-term thinking, the long-term, the innovation, but also the, you know, the engagement and investment from the diaspora. If you were to say right now, how can we help? Is there something specific like that your immediate need that the diaspora can actually take action at this point in the immediate short term?
Yes, actually, the immediate short term, I think any people in the diaspora that can help in case management is absolutely critical. We need people because the situation is going to worsen in terms of case. And I don't see enough physician or people working nurse or people working in the healthcare sector. I think any people that can volunteer support is very important. When we come also to testing right now, we're scaling up our productions and now we need people to support initiatives like how to bring more tests, how to develop more tests, and where the diaspora can help is easier to support through funding initiatives that is actually happening in different parts of Africa, so Africa CDC, WAHO, or actually supporting how to bring tests. I was just visiting a country bordering to Senegal, and actually they're lacking tests, even though they have reserve and tests for, let's say, a week, which is a problem because then they stop testing, then the epidemic, they don't have any visibility. So helping testing to happen and decentralizing in terms of providing kit tests, providing funding, or providing workforce is something that I feel extremely immediate thing where people can do and help the continent.
Great to hear, Dr. Sal. I'm going to try to see from the chat. So many questions are coming up. One thing I'm seeing here is like, can the technology used to develop the COVID test leverage as a platform to develop affordable and quality tests for the prevalent genetic diseases in Africa, such as sickle cell disease, for example?
Yes, absolutely. This is one of our targets. Actually, this technology has been found simple. And right now we are bringing other people to be able not only to detect proteins and antibodies, but also to be able to detect molecular, to use it as a molecular test. So I think sickle cells is one of the targets, but the main thing of this project is neglected tropical disease and also epidemic disease. Right now we have in the pipeline yellow fever, Ebola, measles, sickle cell maybe a little bit later. And these are right now what we're working on in our agenda. And yeah, this technology has been chosen because it's flexible and very affordable, and always trying to get it at the cost of good, which is no more than $1.
That's wonderful. Good to hear. I'm going to ask you one last question because I know very soon we are going to pass on the forum to another group, the panel. When you think about, you know, our cultural situation in Africa, you know, something such as social distancing is really very challenging. How would you see the role of the youth in Africa in helping with fighting with this, such as like contact tracing and educating? You mentioned it earlier, education of the population is absolutely important. And we have a lot of very dynamic youth, very creative people there. How would you see the role they play and how can we help?
Yes, I mean, we're very lucky to have young people. And I think the main role, usually when we discuss that, is it goes to them because even though they can be infected, they seem to be less at risk to evolve severely. And when we see right now in Africa, in many areas, that's the young people, through the movement they have, they can bring it in household. So in Senegal, what we have been doing, working with social anthropologists, is to train those young people and use them to go into the household to try actually to convince and promote the use of barrier and social distancing and physical barrier, like wearing masks and also making sure some people wash their hand and observe at least the social distancing in certain contexts. And the fact that we can use these young people can be extremely important because they are mobile, they're usually very active. And that's what we as a social anthropologists, we developed this strategy. And right now in Dakar, for instance, 12,000 young people are being trained to go in each of the health districts and try to talk at the household level and make sure that they identify vulnerable people and they have the right message in terms of orienting people to go and being tested when they have symptoms. And I think that's critically important.
That's wonderful. Thank you for that. I'm going to pass it on to the panel. And does there anybody have a question for Dr. Sal at this point for the audience here? Please put it into the chat box and we'll be happy to share that with you as well.
And yeah, there were a couple of questions. You didn't see them, but it was a question for Dr. Sal. What is the status of COVID in Nigeria, in Senegal? And there was another question whether, I can see this is a Senegalese asking, Senegalese students are going back to school. Is it safe to let them go back to school? So these are two different questions.
Oh, okay. Yeah, thank you. Thanks, Almaz. Maybe we can start with the situation of COVID in Senegal, in Nigeria. Somebody was asking that question. There's so many questions coming in, it's great.
Yes, I think in general, actually, to avoid being too long, the situation is progressing in Senegal. We have more than cases. Right now, we have more than 13,000 cases already. We have more than 200 deaths already happening. And the situation in Senegal actually is that the severe cases actually are progressing. And when we have this severe case progressing, what we are focusing on two things. Number one is to make sure that transmission is not happening because of medical barrier, physical barrier, and trying to make sure that people don't get infected. And at the same time, we're taking care of the people that are severely ill through some new treatment that we are doing. And now, now that the people are going, we cannot test all the students, but what we are trying to do is here to make sure that if people have symptoms and have very strong measure within the universities and within the schools, with having social distancing, making sure that minimal hygiene measures are being taken care and making sure we monitor temperature. That's what has been decided so far with the monitoring of this situation. We can avoid to have the schools being area where amplification of transmission is happening. In Nigeria, we have a similar situation in terms of we are in a raising phase, even though in Senegal it's a little bit more stable. The main issue is that in Nigeria, we cannot reach all people. So testing, we need to do more testing. But the cases are getting more and more severe again. And we have a situation which is similar in Senegal, where they are opening the country like in Senegal, they're opening the country, so they may have more people coming in and more transmission potentially happening in terms of imported cases. But the main situation is really to be able to take care of the patient, the severe patient. That's going to be more and more important now that cases are being more and more important. So being able to treat them in terms of intensive care and taking care of severe cases is now one of the major priorities.
Fantastic. Thank you for that answer. One last question before we move on. What is the perception of Africans to vaccine testing to the vaccine in Africa? What are your thoughts about this, and are there any vaccine being developed in Africa currently?
Yeah, actually, when it comes to vaccine, actually, there is a sort of pushback because there are a lot of discussion about African being used are sort of guinea pig for some vaccines or being used actually to test some vaccines that are not good enough. And there's a huge campaign we call the People Against Vaccination that are actually making videos about vaccine as a way to control people or vaccine as a way to disseminate some disease or working to sterilize people. So these are different things that are not playing for vaccine. But the situation, even though is growing, is not as bad as it can be in some area that I see in Western countries. Now, right now there is two countries, Nigeria, South Africa, and Kenya, that are enrolling in some sort of clinical trial, which is, I think, a good thing, because it's important that this vaccine being evaluated in Africa, because it can provide access. And when people talk about equitable access, we should also be in a position to test those vaccines within our context and make sure we have it. So even though the perception may be a little bit kind of mixed feeling, people may want a vaccine, but at the same time, they're worried about how it can be used. This is something where people are putting a lot of hope, and for which authorities are actually working to make sure it comes in a safe condition and control in terms of ethics. Over to you.
Thank you, Dr. Sal. I know it's time for the panel, but I'd like to remind everybody in the audience that Dr. Sal will remain during the session, and he'll be able to respond to some of your questions as well. But before I pass it on to Josh, let me just say thank you so much, Dr. Sal. I feel like we need more time. This has been such an interesting conversation, but I'm happy that you're going to be able to stay for the rest of the event. But thank you again. It's really a great pleasure to have you here, and thank you. I know you are very, very busy, so really appreciate your time and helping us through this. And to the audience, you have heard it, you have heard the opportunity, you have heard the challenges, but again, like you said, in any opportunity, in any challenge, you see an opportunity in there. And you have the short term, you have the long term, and we all, as diasporan from Africa, even the Friends of Africa, we have the responsibility to get engaged, and there's plenty of opportunity here. So thank you again, and I'm just gonna pass it on to Josh at this point.
Perfect. Thank you.
Thank you, Andy. Well, so Josh, while you guys are getting ready, I'm launching the first 3 questions of our poll. You keep talking to your team. I'm just launching.
That's great. First of all, I think thank you, Dr. Sal. It's and I'm actually, I appreciate the fact that you're also going to take the time to stay with us during this panel session that we're going to be doing next. We'll direct some questions to you as we discuss specifically, since you brought up what's the role of diasporans. There were 3 things that I wrote, which is the human capital and the knowledge, the expertise that's needed, the investment piece, but more importantly, the innovation piece. How do you actually bring ideas, and how do you scale them within the continent? So we're going to discuss that with our panel. I'm very pleased to welcome our 3 panelists. It's just incredible to get this caliber of expertise into our discussion today. Let me start with Josephine. Josephine is the Chief Science Officer at Sanofi Consumer Health. Again, I think what you're going to see is the expertise that each of our panelists brings. And Josephine, as she answers a few questions, she'll be able to talk a little bit more about her experience in the healthcare industry across Bayer and Sanofi. Alan, who's the Executive VP in Consumer Health. He was recently an executive board member and committee member with Sanofi also. Alan is Scottish, so friend of Africa. He spends quite a bit of time in Africa, and I know he's involved with a lot of work that's going on around self-care, global self-care, which I think that's going to be important also, because we want to touch that, because as much as everybody is putting a lot of time into COVID appropriately, so at this time, it's important that, one, we don't lose what's happening in the continent. All the progress that has been made in so many areas doesn't get forgotten, but also how to use the lessons learned from this for the future. So we're going to discuss that. And Eliane, I met Eliane actually, I think it was about 3 years ago in Rwanda. We were at the Next Einstein Forum. She's a professor at McGill University, but also an advisor in the National Science and Technology Council and an advisor to President Kagame in Rwanda. So it's great to have everyone. For those of you, just to introduce quickly about who I am, I'm Josh Gaim. I'm originally from Eritrea. Same thing with Almaz. And then I spent the last 13 years as Chief Technology Officer and Head of R&D for Johnson & Johnson Consumer Health, and now I'm CEO of Small World and a new venture group that I run. And this is very important as we discuss this, which is, to Dr. Sal's point, the human capital, the knowledge that you're going to see from our panel and the people on this call. There's incredible expertise in healthcare. And how do we leverage, again, we're not asking everybody to go back to Africa, we're just asking people, what is the expertise that you bring and how important that is to mentor, to participate, to bring some of that innovation into Africa. And I think a lot of our effort is actually going to focus on that today. Let me just start with Eliane. I know she spends a lot of time in Africa. She has a broad view of what's going on in the continent. We're going to start by talking about the state of healthcare in Africa, because we heard from Dr. Sal on the ground what's happening. Now, what's the view when you look at it from outside of Africa, for those of us who live outside Africa? So, Eliane, would love to hear your point of view in terms of what is the state today, COVID, and then post-COVID, what should we expect?
So I think that's a very large question,
yes.
Josh, to start with. I'm like, why do you give that to Alan or Josephine? So anyway, I'm going to plunge in. So yes. As a member of the African Academy of Sciences, I've been involved in writing a white paper on African health sovereignty. And so the aim for me is where do we go from here? And how do we build the needed capacity on the continent? How do we connect the continent with the diaspora and friends of Africa to grow health systems, to grow investment, to grow research and development? Because I think we really have to find a way to ensure that we have a lot of demands on governments in terms of increasing the percentage of GDPs going to healthcare. But if we look at the companies right now working on vaccines around the world, so none of them are African. Okay, so I look at a company like Moderna, whose valuation has just gone through the roof through these last few months. What we need is African companies that are contributing locally and globally to growing the economic contribution of healthcare to the African continent. And with that, we can have more incentives in terms of how governments contribute. Clearly, there's a lot of progress to be made. I look at what's happening in my country, in Rwanda. I'm very proud of the efforts being made right now around COVID, whether it's using robots, pool testing to see how we can reach the maximum amount of people, and also socioeconomic initiatives like how do we ensure that digital financial transfers are allowing people to continue to do transactions while minimizing the spread of the virus. So I think there's really important things in terms of how do we increase the amount of people working in the healthcare industry? How do we make it sexier? How do we ensure that they have adequate pay? And how do we harness digitalization to make it more efficient, to ensure that the system allows us to bring in the needed medicines and ensure that they're of the highest quality possible, traceability from where they're produced to user? And how do we ensure that we look at all the ways that innovation is helping? We just look at what's happening in terms of ventilators and the different companies, that local innovators in Africa that are creating ventilators that are much cheaper and can be contributed to the health system. So I think there's a huge opportunity in terms of how innovation can help us move forward. The current state, we need a lot more people in the healthcare industry. That is clear. But I think it's really important to look at it not only in terms of how we are serving hospitals and community health centers, but how are we growing the industries? And that's really important to really creating a healthy ecosystem that has sustainability and that allows governments to see that their investments are going to build local wealth and local health.
I think that's great. Eliane, this is exactly why I asked you first, because you're going to lay out a much broader landscape for us to deep dive into each of the sections. So this is perfect. So let me talk to Alan first, and then I'll go to Josephine. Any input they have based on what Eliane started?
Yes, well, thank you very much, and thanks for the opportunity to join the call today. Now, I completely agree with Eliane that it's a lot about the investment, it's about the human capital on the continent, but also supported by those in the diaspora who can bring that expertise, as Dr. Sal mentioned, back to support and help the initiatives. I think one of the experiences that I've had is working very closely with the African Leadership Academy and the African Leadership University to talk about the future leaders of Africa, and many of whom are interested in healthcare. Unfortunately, many have had to go overseas to further their education, but are now wanting and interested to come back. And I think it's very important that not just the governments, but institutions and also enterprise look to harness that human capital to invest back in on the continent. So I've been amazed with the young students that I've mentored over the last few years. Again, I would encourage anybody on the call today, if you really want to make a fast contribution, if you would like to mentor one of those students, or if you have internship opportunities to give them that experience, all of the details will be on, I think, the website, so you can go check it out. I think the other thing that was mentioned was around the growth of manufacturing. Significant discussion around supply chain globally. Obviously, I come from more of the industrial side, from the consumer healthcare side. But it's very interesting to listen to the dialogue now around the security of supply of all medication, not just specifically COVID-19. My company was a major manufacturer of paracetamol products. There was a huge concern at one point because of supply chain being heavily reliant on India and China, and a lot of discussion now happening about how do we look at spreading the risk of API supply, and there's no reason why Africa should not be part of that discussion. And I know, for example, in the European Union, there's some discussion around even specific funding to look at developing and growing API manufacturing capacity in some African countries. So I think that those are areas that I think will be very important. And then the final point I would raise, you talked about the importance of education, about spreading good information, relevant information that people can act upon, whether that's in the consumer phase, whether it's in the healthcare professional arena. I work with the Global Self-Care Federation, which is an industry association, but it's affiliated with the WHO. And we're working closely on the harmonization of regulatory systems across Africa to try to make it easier and simpler for people to get access to the right medication in the right place. You know, self-care, I think, has a role to play because it eases the burden on the rest of the healthcare system. Of course, it's not the solution for everything, but it's very important that people have confidence in the data and the information that they receive. And that's why it's very important that we work closely with all of the key stakeholders to try to make sure the confidence and the trust level in the products that people are offered in Africa increases. We recently did a survey, which is a precursor to work that we're doing on a self-care index with the WHO, which shows that the level of trust in medicines, particularly self-care medicines in Africa, is the lowest around the world. We did a survey globally, so there's real work to be done to raise the level of confidence for consumers to really participate in the healthcare system.
Great, thank you, Alan. Josephine, along the same line, I think I think you've heard what they discussed in terms of where Africa is and what are some of the things, but also the role of innovation. I think as a Chief Science Officer at Sanofi, there's quite a bit of work happening in this space, regardless of which pharma company you talk to or which consumer health you talk to. There's actually, this is showing a much better advance, and I've been in the industry going all the way to Pfizer and J&J for myself. The collaboration, the only time I've seen this type of collaboration was actually during Ebola. And then it went away, and then now COVID, everybody is collaborating. It's a question of what are you seeing for Josephine, and then how do you make this sustainable? And I'm going to come back to Dr. Sal after that, based on what he heard from all four of us, to see what his thoughts are. So, Josephine.
Yeah, so thanks, everyone. I'm really excited to be here. Thanks, as you know, for the opportunity. This is wonderful, right? To have this group of folks interact and talk about Africa, a topic that's near and dear to my heart. I will have to say that telemedicine and technology, right, will play a significant role in accelerating healthcare, right, in the continent. I just read a recent article in The Lancet recently that dubbed sub-Saharan Africa as a new breeding ground, right, for global digital health in terms of both patient management, disease surveillance, and prevention. And Africa has the largest, disease burden within, right, in the world. And however, we have the smallest number of healthcare providers right on the continent. So we really have to sort of think about how we do things differently. And I truly believe that telemedicine will play a significant role in how we do that. And what I want to just actually share a personal example of where I have seen this happen, because I think it really brings it home in terms of the opportunity and still some of the challenges that we face that we need to address. A family member of mine was just recently diagnosed with kidney cancer, right, in Nigeria on the continent. And of course, well, he's an American citizen who decided to go back home, right, to make a difference. Of course, the first thing you think about typically is, bring him abroad, right, to have the surgery done, where the healthcare systems, right, are better. But we couldn't do that because he was diagnosed, right, under the conditions of COVID. So the borders were shut down. We had to do the work that needed to happen with him from a healthcare perspective, right, on the continent, in the country. My family and I did a lot of research. We identified some highly qualified urologists, radiologists, oncologists, that were able to conduct the surgery in Nigeria. However, right, what they did was they ensured that there was consultation between not just them, but between other oncologists and doctors in other parts of the world. So there was ongoing consultation in terms of what the best care was, right, for this, particular family member. And it really brought to life, right, the role of telemedicine, not just patient to doctor, but doctor to doctor as well in determining, the care, right, the right kind of care, right, for, this family member of mine. My husband was able to involve Sloan Kettering. There was a lot of work we had to do that. And Sloan Kettering, for those of you who don't know, is a huge oncology center, here in New York. We involved them in the conversations, had a really good conversation with them about care. But one of the challenges that we faced, right, was in sharing the data, right, with the different consultants in different parts of the world. That's a significant challenge. There was some mislabeling that was done, some misinformation that was shared that we had to walk through, right? I mean, I bring this up to say, yes, telemedicine will play a significant role, right, in how we advance healthcare and the provision of care. However, there's still some challenges, that we face that we have to overcome. And I think the other thing, that it brings to mind, for me as well, is making sure that now we can afford to do that. Not everybody has that kind of access, and not everybody has that kind of means, right, to employ different kinds of consultants in different parts of the world to provide care for a family member or for themselves. So that's the role that we have to play in making sure that, we can bring access, in making sure that, everyone can afford, right, to do this. For me, I'm seeing a lot of bright spots. I mean, I just read an article recently that talked about the use of mobile phones and talked about smartphones, right, in advancing healthcare. Africa, as we know, it is booming right now as it relates to the use of mobile phones and smartphones, and a number of people that are actually signing up mobile accounts and getting their cell phones. So I think as I look at the landscape of telemedicine and technology, we are making some progress. We still have some ways to go, but we're making some progress.
That's great, Josephine. And I'll go to Dr. Sal. It's interesting. I think you brought up digital telemedicine. It's interesting. We even advance in the US. It's interesting that this is a space, when I left J&J, this is an area I focus on telehealth, being able to do a lot of things that don't need to go to a distance. You have a mobile phone, you have broadband, to be able to get access to healthcare that's as good as seeing a doctor, which basically includes some diagnostic opportunities, be in medicine being delivered directly to you. But it's interesting, as we even talk about that, granted, it's getting accelerated quite a bit. To give you an idea, in the US, only 11% of the population used to say telemedicine is a great opportunity before. This is just patients basically not feeling comfortable to see a doctor through digital before COVID. It's close to 78% right now. It's just incredible transformation. What would have taken about 10 years just happened in about 3 or 4 months, basically, even in the US. And for Africa, it's a little bit even more, it could be much more advanced, knowing that the presence of broadband continues to expand, the ability. But obviously, I think Eliane and several of our panelists brought it up, that says, you know what, there's a human capital issue. You don't have enough doctors, you don't have, and that's very difficult to solve because most countries have the same issues, whether we like it or not, including in the US. But the reality of it is then, how do you leverage technology? I think last time we did a similar panel on healthcare, we noticed that there were actually more doctors, more African-born doctors living outside the continent than in the continent. Doesn't mean they all have to move back to Africa, but why not use those resources in the case of telemedicine to actually get more access and get them involved, so that not only from a mentoring, from second opinion of what's happening in the continent, but how do you leverage this network? So Dr. Sal, I think you've heard a lot of the discussion around the broad strokes of the things that could happen. Would love to hear your point of view. One, it's interesting, there was a question actually for you in the previous session that says, what's your dream for healthcare in Africa? And I would love to see, if you had a blank sheet where you're just getting to map what the future could be, would love to hear your point of view, what you see across the continent.
Yeah, thank you very much. I think I see three very important things that can change completely healthcare. Number one is really to build ecosystem where innovation can happen. In healthcare, in any area where you go, in whatever country, you can see innovation that are really nice. Completely imagine local innovation, but very difficult to scale up because no capacity to make it larger, no industrial capacity for things. Having a really an ecosystem that can take any of these innovative ideas and bring it at the level where it can serve the largest community country, I think is something extremely important, particularly when it comes to health, because many solutions happen, but you need really to adapt it to what people are used to and to context where they're useful. I think the number two is really, we are lacking most of the things that we need to do good healthcare in terms of goods. I think your first speaker were mentioning about making sure that you develop some sort of sovereignty about capacity and autonomy to make those products. This is really the number two things I wanted to see. And the last part is, I'm a bit worried that Africa is thinking in health system the way it is now as an expansion. We need more hospital, we need more nurse, we need more doctors. And I believe now with data science, with artificial intelligence, with all these point of care testing, we have a great opportunity about making a system that's completely different from what exists so far. Because we have a completely different, we're talking more about community healthcare. How do you reach people? I mean, in most of the developed countries, when you're sick, you go to hospital. In Africa, you need to go to some sort of different level, where the level of care and what you need is something different. So I'm really dreaming about changing the whole system and adapt it completely to the situation where you can reach people, use very high technology, and being able actually to adapt it constantly with the innovation that happen into the continent.
Yeah. No, absolutely. I think that's great because yeah, just repeating what has been done in the past, including in other countries, is just not the best solution, because the way technology is changing, the way digital is being enabled, the way people are getting access to information through digital just changes a lot of the things that we should be thinking about. Eliane, going back to you in terms of, I know you were very passionate when you and I spoke last week about how do we change investment in Africa? Because that's a big part of the issue that we see, is that it's not lack of ideas. Seriously, granted, I can't go now there anymore, but when I used to work for J&J and we visited a lot of different innovators and different incubators within Africa, we see incredible ideas that are relevant to the continent, relevant to healthcare, but none of them actually make it because it doesn't get supported. I just don't think that governments are going to be able to manage all of it. So it's the entrepreneurship spirit, getting entrepreneurs to get the support they need, whether it's mentoring, financially, all of that is going to be important. So how do we change this narrative? How do we get people to invest, whether it's Africans in diaspora, Africans for Africa? and other investors into the continent?
So I think part of it is, what are the narratives we're hearing? I think there are good stories. We don't hear enough of the good stories. One story I love is the M-Pharma story, in terms of putting traceability from production to the patient in ways that they are working with pharmacies as well as hospitals, and decreasing the rates of, they're ensuring that patients are getting quality medicine, ensuring that there aren't errors being made at hospitals in terms of giving people the wrong medicine. And this has accelerated the quality of care. They've raised over $20 million. They've been around, I don't know, maybe for about 5 years. I think they're already in about 4 or 5 African countries. They're already also looking at nonprofit work in terms of giving back to the community. And I think what we need to do is have more of these stories branded, to say Africa is open for business in the healthcare space. And also, I think one of the things we have to remember is Africa is the cradle of humanity. So in terms, as a geneticist, I think of all the work we should be doing, looking at pharmacogenomics, at personalized medicine, and mining the African genetic data sets in terms of finding solutions for health issues in Africa and globally. So I really think that we should be aiming to leapfrog to the highest level of healthcare innovation for the world as Africans. And also, because we also have 26% of the biodiversity of the world in terms of plant and microbial biodiversity, these are amazing spaces in terms of chemical space to find new molecules. And so I think what we need to do is leverage the telemedicine, we leverage digital technology in terms of education to train more people across different areas, because we really need Dr. Saul talked about the ecosystem. We need an ecosystem that's functioning at the private level, at the education, at the R&D, at the policy making level, so that we can really drive this for local and global growth. And so I see this as really important. And also, you and I were at the Next Einstein Forum 2 years ago. That was an amazing forum, because what it did is it brought African innovators, it brought investors from around the world, it brought high-level executives like you to see who were the young Africans who were doing brilliant, amazing work that was spanning so many areas. And so part of it is people who are in the healthcare investment field outside of Africa don't have a vision of the exciting things that are happening to be involved. And at the same time, I think one of the things I'm also very proud of as a member of the African Academy of Sciences is that now the African Academy of Science has millions of dollars investing in research in Africa by Africans. And so these are things that are being leveraged. I look at the Grand Challenges exploration programs with the Gates Foundations and the Grand Challenges Canada, Grand Challenges Africa. These are all initiatives that are increasing research to innovation for Africa. And so I really think what we need to do is make sure that the visibility of what's great is out there and that we brand it, because that's really where the risk is people don't know the great things that are happening. I just look at the amazing people here today. Most people don't realize that there's such brilliance in the healthcare systems across so many different disciplines who are African, in Africa and outside of Africa. So that's really the excitement I have. I look at one of my colleagues on the Presidential Advisory Council who has started his own cancer company, and he's looking for new medicines, Clet Niokize, and who's doing great work, and who started out working for major pharmaceutical companies and started his own company. And he's raised a lot of money. And so part of it is, let's multiply the good stories. Let's continue supporting youth that are advancing. I see my own career. I mean, 30 years ago when I went to university, I couldn't have imagined being on a panel with such African brilliance today. And so I just say, we just have to grow this pie. And so part of it is switching the mindset to say, this is a land of opportunity and brilliance. And by 2035, half of the workforce on the planet will be African. Let's use that effectively.
Absolutely.
I love it. I love it. I think Josh, if I may, right? I
No,
think
no,
it's
absolutely.
such great passion, Eliana. I absolutely love it. And what that brings to mind is I have a doctor friend, right, who's practicing medicine on the continent. And I had the opportunity to have a conversation with them, before this panel discussion. And I was sad that I didn't do that. I didn't do that, prior to understand the amount of work and how innovative, they're having to be, given the fact that they're practicing medicine under really suboptimal conditions, right, on the continent. So lack of infrastructure, lack of power, lack of connectivity, and the list goes on. He works in a hospital that's really practiced at addressing Lassa fever in a really small town in Nigeria. So they treat Lassa fever, and they also treat viral hemorrhagic fevers. But they have some strong collaborators, right, in Germany and in the US. So before COVID even broke in the continent, right, in Nigeria, before the first case was reported, they started having conversations, right, with these consultants and with their collaborators. And what they were able to do very quickly was put a system in place and build the capability of testing, ensure that they were able to respond very quickly with testing and with training, making sure that they had the right kits, right, to do the training, as well. And they were able to set up, right, before the first case was even reported in Nigeria. And then they scaled that capability, right, to other states, within the country to ensure that they could test and treat COVID. To date, I think they've treated about 400 patients. Only about 18 of them have died. And the ones who died were because they had comorbidities, for the most part. And I say that to say, right, that every one of us, right, we have stories like that of people who are doing heroic things on the continent, who are having to be innovative, just given the circumstances they're working under. How many of those stories, to Eliana's point, can we shine a light on, amplify, brand, and help people see that there's really good science that's happening, despite the fact that we lack some significant means of, making some of those things happen as it relates to healthcare. I just think the more of that we can do and amplify those stories and brand them, the better for us.
Absolutely. I think it's interesting. This topic is actually, there's a follow-up we need to do on this, which is, what is the role of African diaspora, Friends of Africa, in doing this amplification specifically? And by the way, this is more not just telling others, but more also, what actions can you take after that? So how do you support the person that just, I think Dr. Sa highlighted it, which is they have the idea for a diagnostic, or they have an idea for a ventilator, or they have an idea for a specific, and that's the brilliance that you highlight. But then we need to be able to, all of us that are especially in the diaspora, have to take that idea one step further, which is, how do you bring in an investor? How do you bring in a network that actually enables that one person's idea to move forward? It's interesting. I think Eliane brought up, I was in Senegal, actually. That's where the first Einstein Forum was launched a few years back. And then the second one was in Rwanda. So I've been to both of them. And after going to Senegal, what we saw there, immediately, myself and a few of my colleagues from J&J, we actually launched what's called the Africa Innovation Challenge. Because in that Einstein Forum, we actually saw a lot of really bright ideas, but the problem is they couldn't take it to the next level. How do you scale it? And I can tell you, when we launched the Africa Innovation Challenge through J&J, granted, we only selected 3 innovators within the continent. They're all thriving and doing incredible business today. We even run 2 years later a second one, focused on healthcare. I think we selected about 5 different innovators and companies. Those are doing really well. So I think it's almost like that was just a small doing, leveraging companies like J&J. All of us that work with big companies, all of us that have the connection with investors, what do we need to do to amplify what's happening? Not only tell the good story, but we also have, I think we all have to take responsibility to back it up with creating that connection for them to advance that, what Dr. Sa highlighted, which is how do you scale? Because that's going to be always the difference. You can come up with ideas, but if you can't scale it, it doesn't go anywhere. So Alan, what are you hearing? I know you sit with different global groups that are discussing COVID and other areas, but would love to hear your point of view based on the discussion you just heard.
Yeah, well, I can only endorse what Eliane and Josephine have been saying. I mean, we at Sanofi were a sponsor at the big Vivatech digital technology conference, and we've sponsored for the last 3 years the Africa booth there. And I was lucky enough to be one of the judges that was able to look at some of these great innovative ideas that were coming from Africa, and then supporting 3 or 4 of them, a little bit like you described, Josh, as well. For me, I think what it's really coming down to, we talked about storytelling, about getting the message out, about really making the connections and building the network. I think somehow we have to describe the African opportunity. You talked about, you know, the future of the world's population. Young people under the age of 25 is going to be 50% of them in Africa by 2050. So it's a huge opportunity. Again, going back to what Dr. Sal said, looking at the opportunity rather than at the difficulties. I think if we can persuade the larger corporations that this is a new emerging markets opportunity, like they saw in China, like they saw in India, and really make sure that the stories are told about the opportunity, and really the investment will come. There are investment opportunities now. I've been talking recently with some impact investors who are doing private-public partnerships. They've raised already around 400 million. They originally were in microfinance. They moved towards agriculture. But of course, now with COVID-19, there's a high degree of focus now on healthcare. So they see opportunities. They've been able to raise funds. They've been able to deploy some of those funds. But it needs people in the diaspora to help and support that, to bring the expertise so that they feel confident in those investments as they take the risk of putting money into programs in Africa. So I think there's a lot of opportunity, but I think we have to get the story right. I think Almaz's platform and opportunity is a great way to help to do that. For example, the African Leadership Academy have just set up an AL for Health network to try to connect everybody around Africa in the healthcare space. I know one of our friends, Yvonne Mburu, who's in Kenya, a researcher in medicine, but is also trying to create a platform to connect healthcare researchers around the continent, but also around the diaspora, to work collaboratively on different projects. So I think it's about network. I think it's about telling the right stories. And I think it's about really making sure that we see the opportunity from an investment point of view, because in the end, the private sector will want to see some type of return and not take too much risk. It's just a fact of how the economics work. So I think if we can do that combination, it's really a very positive future.
Yeah, no, that's great. Dr. Sal, based on a lot of the things that we're discussing, which is how do you amplify, how do you actually push more investment, would love to hear your point of view. If you had to ask all these people that are on this call from a diaspora perspective, what are the 1 or 2 things you would say, hey, I need your help with these 2 things? What would that be? And I'm not talking about you personally, but just the African healthcare system, the people like you that are on the ground actually day in, day out, trying to figure out what to do.
One thing actually, one innovation that really amazed me that I want actually to be seen scale up is some platform currently we are building where it helps actually through some digital platform to do contact tracing, connect that with patient management, connect that with surveillance. Because one of the major problems we have when we do outbreak management is to have the right information, the evidence to be able to take the right actions. So, and it is lacking in all the country I've been visiting. I've been doing that for 20 years. I've never seen a system where you connect decision to real evidence. And having that in real time can change a lot in supplies management and these sort of things. So this is one innovation I would love to see happening. And the other thing is, I've seen some very interesting system in one of the country where they have sample transportation that is being done with some technology, some connected box that was actually funded through some grand challenge exploration from Gates that I see. And these are 2 things that I think can be extremely important because we're moving a lot of samples and this is delaying a lot of epidemics in terms of actions. So these are 2 sort of examples. But many ideas around that, how to these little improvements that can change the whole system. I mean, too much paper actually around the health systems, and in the field of diagnostic also, which is really the entry point. There are a lot, any point of care diagnostics that can be scaled up at the level where it makes sense would be also important. Over to you.
Yeah, no, absolutely. I think that's an area that, by the way, is not just for Africa, for the rest of the world. Having this capability as technology advances, the diagnostics that could be done, point of care, at-home diagnostics, then telemedicine even becomes amplified much better, because doctors have data regardless of how remote they are. They'll be able to see data and do the right diagnosis. So absolutely. And we're going to make sure, I think, I see Alma's posted in terms of what do we do as we move forward. We're going to make sure from an ADN perspective, we have this discussion. How do we help amplify? How do we continue to tell the story? But at the same time, how do you then bring those ideas, those innovations, so that they're able to scale, they're able to get samples out, you're able to do some of the diagnostics that is needed. So we'll make sure we get to that. My next question is more broadly, I think, for those of us who live outside Africa. What is the role of each of us? What are we willing to do? How far are we willing to push? So I'll start with the panelists, but the rest of you who are also on this call, feel free to comment. What are you willing to do as we move forward? Because this is a grassroots approach that is needed. It's not going to be one government that's going to be able to solve all the challenges, but it's more just each individual doing a small part to actually advance it. So we'd love to hear from our panel first, and then I would love to see some of the comments on the chat to see what are you guys at the 127 or so people we have on the call right now. What are you willing to do to help? So who wants to start? I won't pick on Eliane, but she can volunteer if she wants.
I'll go. I'll just
Okay.
go. What's really exciting for me is so I see there's Noella who sent me a private message. She's from Rwanda and she's doing her PhD in the US and she's excited to see me. And so I remember 20 years ago, I was giving conferences in Rwanda and young women who are starting the bachelor's degree. Now I'm meeting them and they've finished their PhDs and now they're working and they're like, you know, I saw you and I believed I could go there. So part of it is, what is our engagement? Whether if we're in the diaspora, how often do we go back? Right now, we're in the Zoom world, you know, how we can mentor, we can give talks, we can mentor one-on-one, or through platforms like we have today, we can mentor hundreds of people. And so I've mentored through the African Academy of Sciences in this large way in terms of giving sessions on my own journey. I'm an advisor in the International Masters in Health Leadership at McGill, where every year I get to coach a medical doctor on their global health projects. And through that, I've been able to do amazing things in terms of connecting people in Africa and globally, and work with people who don't necessarily feel that they have the confidence, but they have the great ideas. And so part of it is, how do we support excellence and how do we support the people? Because often people who are really innovative may not always have the necessary confidence. And what I've seen, you know, in the venture capital world in North America and Europe is when people are pitching, they're pitching with confidence. And so part of it is, how do we support African innovators to pitch at that global level where their storytelling and the excellence in science are at the same level? And also, one of the things is, let's ensure that Africans get authorship on papers. I see sometimes papers that are reading, you know, on global health, and there are no African authors. I'm like, you know, if you did research in Rwanda, there is no way you did this without consulting or getting somebody. So how do we ensure that recognition of Africans happens at all levels so that it helps them get to the next level wherever they are? And writing letters of recommendations to help people win grants, win fellowship, share information to ensure that programs like the Innovation Challenge to J&J, that more people have access to do it and know about it and are applying for it. So part of it is, how do we use what we have? You know, there's this expression that data is gold, but in order for it to be gold, we have to have the means to get people to have access to it. And so I really believe in the power of networks to grow other people's opportunities and uplift others. And so that's what I do is how can I uplift people on a massive scale?
That's great. Alan, Josephine, any other addition?
Yeah, I mean, I would say if you have the opportunity to offer internships to young Africans who are interested in joining the healthcare world, please do it. I mean, we at Sanofi have done it now. Not always easy in terms of visas and things, so you have to push because, you know, big companies sometimes get bogged down because it's too difficult to do the visa thing. You know, we found that if you just give a little bit of focus and attention and support to the HR folks, you can get it done. We've had several really first-class interns from African Leadership Academy, from the African Leadership University campuses in Mauritius and Rwanda, joining us in Paris, joining us at our Frankfurt hub. And they've been extraordinary. They give us as much as we give them, but also follow up. I'm mentoring now at least 4 or 5 of those individuals who've worked with us in the past, opening the network to help support them in their next phase, the next part of their journey. So you're just actively getting involved and offering these opportunities for people. There's plenty of talent in Africa. And they just need the opportunity, they need the introductions and the connections that we can give them. So that's what I would commit to do more of in the future.
Great.
I think it starts. So I took a personal look at myself, right? I was asking myself the question, what have I done and what will I continue to do? This panel discussion, this session has actually helped me stop me and help me think about, you know, where I could start to make a difference, right? So educating myself more around some of the wonderful things that are happening on the continent, making the connections, right? Given the role that I have in Sanofi, I have the incredible opportunity to bring some level of visibility, thanks to Alan, and access, right, to the work that's happening on the continent. I talked about some of the wonderful scientific research that's happening, right, with COVID and COVID treatments. There's opportunities for authorship, right, for folks who are actually doing that work, you know, to make that more visible, right, to the to the broader healthcare community. And I truly believe that, you know, some of that information can be leveraged for the greater good of the world and not just Africa. Polio, I just recently read that polio has been eradicated, yay, in Africa. In order for that to have happened, it took everybody, it took a village, it took decades, right, of work to make that happen. It took people sacrificing their lives, right, when they were trying to vaccinate young kids, right, with the vaccine. It took foundations like the like the Gates Foundation, right, to invest in that work. It took healthcare professionals, nurses and doctors. So it took everyone, right, to make it happen. So it's going to take a village. It's going to take every one of us. But, you know, I looked at it personally. I said to myself, what will I do differently? And that's what I'll do differently. So educating myself, you know, connecting the dots. I mean, of course, we all continue to mentor. I'm sure every one of us can give examples of, you know, young African colleagues that we've mentored and who have, you know, looked to us and seen some of the work that we're doing and have benefited from it. But I do think, you know, there's more that we can do as it relates to connecting the dots and just making sure that we should continue to shine the light on the work that's happening on the continent.
Yeah, I think that's great. It's actually, I've been reading some of the comments, and thank you everybody for taking the responsibility to say what you're doing, and some people submitting some ideas. And I wrote a few of them. I think it's interesting because I know Marcia Wolf has been doing investment in Africa for a very long time. Wrote, it just went up, but so I don't have the full message, but at least the key thing was more, she's been looking to invest in Africa, and she's been doing quite a bit of work in that space since 2002. Now the question is, how do we help her amplify that work, which is, how do you start creating that seed funding? How do you start creating that connectivity with other investors? Because there's a lot of investors, myself and a lot of us are connected to, that might not even have considered Africa. Not because they're not interested, it's just not in their neighborhood, and they're not thinking about that. So how do you actually push that? Because if you look at the investment money that's going on right now into healthcare, even here in the US, is just incredible. The amount of funding that's being raised in healthcare is just completely out of control to some extent, but it's rightly so considering what's going on. The Global Public Health Linkages actually just highlighted a few things, what they're doing. The Miller Center for Entrepreneurship at Santa Clara. It's just when you look at that, it's the Builders of Africa, which is sponsored by ADN and the Miller Center. I can go on, and then you bring up each of the companies, the big corporates that we're familiar with, that we work with, what they're doing. For me, I think it's a question then, how do you actually make this visible? How do you actually let people know who to go to, where to go to, and who do they contact? And that's absolutely a follow-up that we're going to need to revisit. I'm going to go back to if there are any questions from the people that we have on this call. But while we wait for some of the questions to pop up, would love to hear any last thoughts, starting with Dr. Sal, your ask of all of us in terms of what we need to do. I think you highlighted a few things, but also any messages that you wanted to give to all the Africans in the diaspora and Friends of Africa. Would love to hear from you to conclude this.
Yes, I think one of the key messages I want probably to convey to you is that we need to build in Africa area where people from the diaspora can repatriate somehow and come back and do some work. I have seen so many either young or people with a lot of willingness to come, but not having area where to do that and express themselves, because it's always difficult when you come back. That's what I'm trying actually to do here with the pharma industry. We have a nascent one with the research, with the public health. And I would be really, I know many people like running institute like me are having this difficulty, having good and bright mind and people that want to come and make difference and mentor them. And if you know of any people that are interested about building cooperation and partnership, I think that's a good way to start. To build the Africa we are all dreaming of. It needs to start with maybe small experience, but this may showcase that you can have a lot of experience, come back to a country and change things. And I think we need more of those examples. You guys have been extremely successful where you are, and you're the pride of Africa in where you are. But we just want to see this happening more and more in Africa with people like you as reference. Over to you.
That's great. Other panelists, any last thoughts before we jump into any, if there are any questions? Alan, Josephine, I won't go to Eliane till.
No, I'm good. I think I had some of the thoughts that I wanted to share as it relates to taking this personally. I think it starts with every one of us in terms of the work that we need to do. We have to connect the dots. We have to think about, we have to be intentional about making sure that we shine the light, we amplify, but then we have to go look for those examples and look for the opportunities to connect. I see a lot of people raising their hands and saying, I want to be part of this, I want to help. I actually saw my husband, right, who called in, right, say he's a black belt, he's willing to help analyze data, partner with Almaz and ADN, to do that, because we're talking about sharing the data and amplifying. So it's going to take families, it's going to take a village, it's going to take every one of us to, make this happen. But I'm committed, right, to making sure that all of the wonderful, innovative work that's happening on the continent, right, the brilliance, going back to Liana's point about that exists within the continent and outside of the continent, that we connect all of that, right, to bring about the impact that I know that, we can have, not just on the continent, but outside of the continent as well.
Maybe just a last comment from me, Josh. I think it's wonderful to hear the optimism on the call, and I think there's no stopping us once we get everybody working in the same direction. Creating those platforms to share, to make sure that we network, that we can connect, I think is very important, and to keep those as open as possible. So you want to attract as many people to support opportunities as you can. But I think they're there. I think people are really interested. I think the COVID-19 situation has heightened people's willingness to get involved and to really support and help to make a difference. I know there's a lot of negative stuff in the press, particularly driven politically in many places, but actually underneath, when you look at what real people are saying, they really are looking for opportunities to support, help, and grow. So I think if we can do that, it will be extremely positive for Africa.
Yeah, no, absolutely. And I think it's, when I worked for Pfizer, they had a program which I thought was very interesting, and I think this goes to where Dr. Sal was commenting. At Pfizer, actually, they used to allow workers to leave the company for 1 year and go to other countries and contribute for 1 year, but then they don't lose their job here in the US. I think it's an interesting concept, especially in healthcare, is the ability, I think to Dr. Sal's point, maybe people are not ready to just completely leave US and move, but at least what I find about the continent is you doing 1 year assignment in a continent and seeing the culture, seeing the people. It's almost like, I hate to say, but some of us have forgotten what it is to be like when you live in Africa. I think we have too much convenience here, but at the same time, it's just the impact you have every single day is very visible when you're on the ground. So as we're thinking about what else can be done, I think we need to be very creative and hold companies and people accountable to say, well, you want to help, here's the things that you could do. Maybe go and work in a clinic because you have expertise in clinical studies. Go to Rwanda and do it, because I know there's a lot of discussion around doing clinical studies. Same thing in Senegal, same thing in Nairobi, in Addis Ababa, in Ethiopia. It's just a lot of countries that have been very open to bring their diasporans back so that they can help build that structure that's needed. I think that's going to be key. I don't know if there are any specific questions. I'm just reading some of the comments. There's a lot of comments, but not direct questions. I think we've covered a lot of it. Obviously, I think it's very easy, and I see some of the comments in terms of lack of authentic data is affecting Africa. I think those are things that come as you build the infrastructure. It's not, nothing is going to be ready the first day. And I don't know, I live 45 minutes from New York City in Princeton, and we saw what happened in New York City when COVID started. The infrastructure that everybody thought was perfect actually just collapsed to some extent, which means that then you have to be extremely creative in terms of how you build it, in terms of what you need to build. The fact that Central Park was actually a hospital, every gym, every convention center was turning into hospitals, shows you how when people face challenges, how they could actually adapt and advance the things that need to happen. And then the biggest question after that is, how do you learn from it so you're not repeating it every time there is a challenge? And that's probably a bigger challenge in terms of for Africa to continue to, how do you use technology? How do you use the capabilities? How do you use human capital to advance things so that we can move forward? Megan, any other questions? I'm trying to see if there's...
No, there are no questions, Josh. There are more comments, as you said, but I think there is one opportunity for us to maybe go a little bit deeper into what Dr. Sal is asking us to do. I think what I'm hearing is a call to action, and this call to action comes in too many ways, but one of them is repatriation of diasporans. Let's just be very frank. It's not always easy to go back to where we come from. We left home because of many different reasons. The diaspora is able to go, some of them, not all of us, because of the relationship that we have with the country where we come from. That's one. The other reason is probably because of families that we build where we are. What I'm asking, Dr. Sal, if you don't mind, is to answer this question to us, which is always in the mind of many of us. And it is in my mind, and as it is in many other diasporans' mind. How else can we support what you're doing? Is it that we need, so we may not be able to really come, but what can we do? And I am going to include Josh into this discussion because on April 28th, we had a similar conversation on COVID-19 to really focus on the local community, because at the time we were also really heartbroken, and we still are, to know that there are more African Americans and of course diasporans also impacted by COVID than there are other minority communities than white people in the United States. There are many reasons, and you've mentioned some of them. But the question for us is the immediate thing that we could do. We've talked about telemedicine. We talked about there are more doctors from Africa living outside of the continent than they are in the continent. what are the first few things that we could do? For me, it's much easier to say it's money, but I also do know that money is not going to solve everything. And so I just want to put that out for those of us who are frustrated. One, we may have some capability, but we cannot go. And I say this because I wanted to encourage our diasporans. We don't have to be doing things simply for the country where we come from. We can do this intra-diaspora, intra-Africa collaboration. If I have a talent that is going to help the people in Senegal, I must be able to use it. So the question is, how do African countries enable the diaspora who want to come and help? Let's say if I happen to be Eritrean wanting to work in Senegal, how do we hold the governments accountable to create an enabling ecosystem so that we can support programs and activities in Africa without feeling I have to do it in this country but not in that country? So I'm going to stop. It's a long question.
So thank you, Almaz. I get two things from people experience like you. Even though if you cannot come like for a long time, coming and doing mentoring is absolutely critical. Because I was saying for many of the people, I mean, you guys have been so successful in what you do. It's just spending time with them, understanding what they want to do and guide them can make a huge difference. And this is extremely concrete. I totally agree. Money is not the issue. There are a lot of money in Africa, more than you can imagine. It's just about channeling it, getting people that invest to be interested to those people. And all the culture you would see in the US, I mean, in all different continents. I've been lucky. I lived in Africa, I lived in Asia, I live in the US, I live in Europe and work in those places. But I feel like the only place where I'm very useful is my own country and my own continent. That's where I really have impact, even though it's great to live in the US and all these places. That's where I think what we're doing is important. And one thing I feel like where I'm useful is just helping the young generation to be believer in Africa and think that they can make it there, and trying to help building the environment where they can feel that they can move forward. I mean, many of them would enjoy living 6 months, a year in the US, and they want to come back because they have a job here, they have research opportunity, and they can go back and forth. But they cannot do that in all sort of labs or contexts. So building that would imply very strong partnership. I know people that every year dedicate 2 months of their time coming here to mentor people in the way they do, discuss their project with them, putting them in connection with people like you or others, help them to get some seed funding. And this is absolutely transformative for many of these kids, because they're very smart, they come to great universities. So this is something people I'm hearing today can be extremely helpful, just helping those young guys and mentoring them, and help build those ecosystems where these people can believe they can stay at home, make difference, and change the thing. Number two is, I mean, there are many people, while I used to study in Europe, in the US, in Asia, I see so many people that want to just go back sometime to help when they're just young investigators or just early in their career. But they don't know how to do that. They don't know where to go. And for me, that's why I think guiding those people and helping them to build a project to get back is also extremely important. And finding people that can help them when they come back. To be honest, the first year I have the opportunity to work and leave, work several years, come back. I did that 2 or 3 times. But anytime when I come back, it's very difficult. I said, okay, is it a good idea to come back? But after 2 years, then I feel like it's a great opportunity. So when young people come back, having someone to advise them, to guide them, because our country can be extremely difficult and challenging, is absolutely important. So in these regards, I think identifying those young guys, channeling them and helping them with the governments can be also of huge added value to what is happening. And for COVID, obviously, I don't think money is a problem. There is a lot of money that people are pouring into this. I feel like getting things organized is #1 problem right now. I mean, I see many African countries, they have a lot of opportunities happening, but just taking the time to organize those, talking to people, getting the funding right, writing proposal and things like that is extremely important. Project management is absolutely key, particularly in this disorganized context. And any help in these regards can also make a huge difference. Our government need to be helped to seize opportunity. Our government need to be helped to understand the people they're talking to abroad. And I think in this regard, people like you can be excellent like ambassadors. You know the two cultures, you can be middle people into that. And I think the government would be extremely grateful, because there are very few people that understand how it works in those contexts. These are just the few thoughts I had to you. Over to you.
That's great, Dr. Sal. It's interesting because looking at the comments and Megan, Almas, if there's a way to capture all this, there's just incredible resources being highlighted for mentorship, for investments, for funding. There's a lot of things that are being highlighted in the chat space. So hopefully we're able to pull that together and add it to the ADN site, basically in terms of future, basically to put it in one place so that people know there's all the resources that are available. Yeah. I think that would be very useful. But I think to Dr. Sal's point, it's very interesting when you look at it in terms of what's happening in the continent, the mentorship piece. This is exactly what we saw when we did the Africa Innovation Challenge. It had nothing to do, some of it was a $50,000 investment, but the resources that were supporting them, somebody advising them what to do on supply chain, somebody helping them develop a business plan, somebody helping them how to hire people and how do you actually get the best out of. So for me, I think Michael Mashrash from J&J is probably on the call. That's the thing that was amazing. And by the way, those people have never been to Africa. Everybody was just volunteering, was in the company to say, there's someone in Liberia that actually needs this help. So they were helping build that company, but the network around them at the end of the year ended up becoming 30, 40 people that never met this company or this person, that the entrepreneur, were able to help them. And every one of them becomes more sustainable in terms of solving the problem. And for me, I think that's going to be key as we look at the session and next steps. Is more, we could look at governments as enablers, but governments are not the ones that solve this. Entrepreneurship, innovation, and this connectivity is actually what solves most of the issues. Obviously, you don't want governments to be on your way, and they could be very helpful in opening that path forward to allow you to move it forward. So I think it's going to be important that as we close this, and I'll pass it to Almas, but a couple of things. One, we need to amplify everything that's happening in Africa. I think that's the role of all of us on this call, all of our network, to make sure that we continue to amplify and highlight what's going on, and take it one step further, which is connect those people to the right network, to the right investors, to the right capabilities. It's just a must do. And I think this is something that we can discuss from an ADN board. How does ADN facilitate that, even to help amplify that? The second piece, I think, to Dr. Sal is be available to mentor people. People in the continent, young people that just have incredible ideas, might not know, how do I get this idea from on paper into a prototype? Believe it or not, that's what's happening was in the tech industry. In Silicon Valley, people going to China and then prototyping, just very quickly getting all the parts, because most of it comes from China. You prototype and then you learn how to scale. So you have people that are constantly mentoring you at each stage. And we have enough people at the African Diaspora Network and our own network to actually enable this, which is pulling the right people to help each idea, to help advance each one of those things that we talked about. And the last piece is, I think there's incredible resources. There's just so many things highlighted in the chat space. Come join us at ADN, be a member. You'll get access to all these resources and no excuses. I think we can do a lot through this mechanism, and it's our job to make sure that let's use ADN to actually bring that voice forward and push what we want to do exactly. So I think we've been talking about this for a long time. It's time to do something as quickly as possible, because that's needed and this is the right time. With that, let me turn it over to Almas.
Thank you, thank you, everyone. I mean, sometimes I just wonder, what am I doing? And now the answer is, every time I see the faces and the minds of all of you, when you talk about amplifying, I'm so proud of the fact that ADN has been amplifying the work of Africans from the diaspora. A few days ago, Ilian asked me why, and I told her it gives me the greatest joy and pride to amplify the work of Africans, women and men, and the Friends of Africa who are doing something in the continent. Why is this important? Because I do believe that change happens when we know each other, when we network, when we build trust. Then there is no question. It doesn't become about where we come from. It becomes about the issue, and we remove each other out of it. And for me, that's where ADN is heading. It's 10 years, it's almost 10, well, it's 10 years of our existence. I ask each and every one of you to support this organization to be sustainable. But let me also say something that has happened. If it's not because of COVID, just in spite of it, we are supported by generous foundations and individuals to continue this effort. I think the challenge that has been offered to us, as I take it as an opportunity by Dr. Sal, and there is that possibility that we might be able actually to do what was said today. And when we send out the summary, highlights, and next steps, please read it. We do send a lot of information, and I encourage all of you to read, because you know everyone wants bullet point, but there is nothing you can do with bullet point. Sometimes I think we should just read and then try to see. And so everyone was asking whether these questions through chat will be available. Yes, actually, one of the good thing about Zoom is you can download them. And what we're going to do is sort them out in a way that is really conducive to the audience and also to what was discussed. We can't do everything, all of us, but we can do something, each one of us, that can contribute to the greater good of society, whether it's in the continent, in each of the 54 or 55 countries, or whatever in the communities where we live. What I promise you is that we will do what the money is allowing us to do. I want to shout out to Silicon Valley Community Foundation, which will address what some of the things that Josh was talking about earlier, and also Dr. Sal, mentoring. We got a seed funding from Silicon Valley Community Foundation in partnership with Santa Clara University Miller Center. They are our partners. We're going to develop a program that will enable Africans from the diaspora and the historical African community to learn and to create their capacity. And then the next step for that is, can they become those individuals that Dr. Sal is looking for, individuals that can come and provide mentoring. For right now, we do have members of the African diaspora who are capable and able to mentor and provide their services. We will tap into them. There is a survey question, is the survey that we're going to send out in a couple of weeks. Please respond to the survey, because your input is what's going to make the changes that is required. We will also be able to know who is Dr. Sal asking us. And I keep saying to Dr. Sal, because he's the one coming from Africa to us. We live wherever we live, we're out of the continent. But when we hear from the people who are doing something, especially Dr. Sal, because of the work he's doing on COVID, I think it's a trustworthy information that we're getting. And the next step is, what can we do as diasporans? I am committed, the board is committed. We are committed to make something happen. So I'm very grateful to all of you. I want to ask you before you leave, there are two things. Some of you who might be interested, I'm going to launch the questions about, there was a second, no, we launched for, I'm sorry, I was trying to send a poll, but it doesn't allow you on Zoom to do the survey questions, but we'll send them to you via email. We do hope you respond to that. Again, thank you to our panelists, to Dr. Sal for making it from Senegal, Josh, Dia, Josephine, Alan, and Ilian, and Dia. Thank you, all of you. Thank you to everyone who's participated. We are testing a networking opportunity because ADIS is really by itself a place where people can congregate with each other and network and all that. We're missing that, and what we're trying to do is test the next 20 to 30 minutes for those who really want to continue the conversation, to network about the work that they do. can we enable them? I'm not sure what that looks like. It's not mandatory. If you want to stay, I will just stay here. I'm going nowhere. So you can stay and continue to network. But those of you who are not able, the meeting is finished, and I am so grateful. We will follow up with a lot more details in the next week or so. And so thank you, everyone. Thank you.
Yeah.
Thank you.
Thank you, everyone.
Thanks, NDA.
Thanks, Almaz.
Thank you.
Thanks so much. Thank you, Almaz, as always.
You.
And thank you, Dr. Sal. Thank you for your leadership.
Yes.
Thank you, Eliane. Thank you.
Dr. Sal.
Thank you, everybody.
Thanks, everybody. Thanks for the invitation.
Thank you.
Thanks very much, Alman.
Thank you. Thank you. Thank you, everyone. Thank you.